Oh, good evening. Welcome back to the Functional Forum. My name is Gabe Hoffman. We're excited to have you here tonight. I'm a co-founder. And we're back at the Helen Mills Center in New York City. This is the last event of the season. Again, the Functional Forum is a multimedia platform and event to promote what's in the cutting edge of functional medicine, to highlight the merging of the technology and medical worlds, and really to bring together top doctors, innovators, bloggers, people who just genuinely care about the future of medicine today. We're very excited to have everyone who's here in this room. We've had a bunch of great events leading up to this one. And, you know, it's always we want to talk about the sponsors, because the sponsors, as we start to put these events on, are really what allow us to do them. And one of the most important things for James and I and Mary Rose has been to work with people who are doing things in alignment with what we believe. So just to talk a little bit about our sponsors tonight coming into this last event, we have AMG, and AMG is here in the back. It's a non-toxic skincare line, and actually Latham Thomas is here tonight to talk about toxic-free birth and childbirth. And she's tied in with the EWG, who have done a lot of work in exposing really the toxicity around cosmetics. So having a really clean skincare line is something that's important in today's world. It's something that people are putting on themselves every single day. So it's something we want to draw attention to. We feel really good about having them here. Designs for Health has also been a part of this from the beginning. Their cutting-edge nutraceutical line. And Jonathan Gallen, whose website Pill Advise, who's another person who comes and is a big supporter of the forum, they're actually having a webinar later this month. It's a week from tonight at 7 p.m. on Lyme disease. If you guys want to learn more about that, you can talk to Mary Rose or your Designs for Health rep. You can also go to their website. N1 Health, they're putting together functional and concierge medicine, and actually a few of their practices are going to be opening up in New York City in this next year, so you guys can check them out. And N1 Health has also been a great supporter, helping us get more doctors into the forum and to be exposed to this type of information. As always, we're streaming tonight. We're streaming live across the country. The streams are then recorded, and you can see them again and again. For those of you watching at home, you can communicate with us and ask questions. We encourage you to tonight with hashtag Functional Forum. We also have a YouTube channel. We also have, where you look at Functional Forum, you'll see the archives of what we've done. You can go to functionalforum.com. And tonight's topic is Lyme disease. Lyme disease is a topic we're pretty excited to bring to you because it really points out an area where certain parts of the medical community have struggled, and then there's other parts that are having a lot of success, and it's really important to present that information. So, and let me just talk about our stream sponsors. So we have a couple stream sponsors, and without them, the stream wouldn't happen. So Hello Health is they create a software, an EMR platform to create more efficient doctors' practices. And we had Dr. Jeffrey Glad here last month, who spoke great and gave us a lot of exciting information about working with that type of technology. And we also have neuroscience, and Dr. Mark is here from neuroscience. Neuroscience is a testing company, and they allow you to have a lens really into what's going on with the body. He's going to be speaking about some exciting innovations in diagnostics, as well as the functional medicine model for Lyme disease. So just thank you to them, and really thank you to the sponsors who have gotten us to this point. We really appreciate it, and we're really proud of this stuff, not just them helping us be here, but also what they're doing outside of here, and we just wanted to take a minute to point that out. So, without further ado, we're going to get started. I'm going to bring up your host, James Maskell.
You call the doctor, woke him up and said, "Doctor, is there nothing I could take?" I said, "Doctor, to relieve this baby, you got say,
All right. Welcome to, as Gabe said, the last functional forum of the season. I will be explaining what the season is. It's not typical that you have a season, but we have a season, and I'll tell you all about it later on. Lots of exciting stuff. Gabe mentioned Jeff Glad was here last month. Since last month, I think a perfect example of why the Functional Forum is and our intention and how it's working. Jeff Glad, who was here, Mark Hyman, who was here, are now collaborating on their project to work with the Cleveland Clinic. So what started and what sort of germinated in the Functional Forum will have massive implications for medicine. So that's a really, one example of how this happens. I know this is not an ideal networking environment, but I know that each of you, you get to meet different interesting people, and so I hope you take full advantage of that before and after. Yeah, Lyme disease, it's a huge thing. I know some of you are here because you have had Lyme. Some of you are here because you want to know about the cutting edge for treating Lyme. And this is a hugely important topic and a very controversial topic. I'm big fans of some people in the room. Paulette Cole is here from ABC Home and Carpet, and Paulette sent me an email this week, actually just yesterday, about the controversy about doctors prescribing long-term antibiotics in the state of New York and some of the bills that are going through in Albany right now. So this is a big topic. People are not really sure what to do. It's a strange and interesting disease, as we're going to see tonight, and I hope that what we'll be able to do is to shed some light on some of the strategies that are really working for this, because one of the reasons why we've chosen Lyme, this has been a 5-part series that we've done, but one of the reasons why we've chosen Lyme to talk about for this last one is, one, this is an area where stuff in functional integrated medicine is working, but two, it's a really good overview of what we need to be doing for chronic disease in general. And Mark Menolascino, I'm really excited to have him here this evening. So let's just talk a little bit about the details and get into it. So before we get into the Lyme, I just want to let you know, because we always talk about technology, we hope to have Jason Wacob here from Mind Body Green. And unfortunately, Jason is not going to be here tonight, but we have an even more exciting guest. But I know Jason won't mind me saying that. Jason is quite exciting himself, but not as good looking as Latham. So no, but Jason, I actually just interviewed him recently, and I can tell you what he would have said if he was here, so we can just sort of take him out together. So Mind Body Green, he's the CEO of Mind Body Green. We've mentioned them before. They just had another record day of 1.4 million unique monthly viewers in a day. They're growing and growing and growing. Jason says about his work in bringing forward functional and integrated medicine through that blog that their goal is not to preach to the choir, but to grow the church. And the Church of Functional Medicine is growing, and Mind Body Green is doing a great job with that. And watch out, next weekend, they're doing their first thing called Revitalize, which is a 2-day event at Miraval. And it's basically going to be like TED, except without the TED disclaimers that this might not be scientific. Like if you look at Terry Walls' talk on TED, it's going to be great. They've got amazing speakers, and check out that. That'll be next weekend at Revitalize on mindbodygreen.com. So this was 2 days ago. We're in sync, and I don't know if you guys know what this is, but this is Apple starting to unveil the fact that they're going to be a massive player in health. This is the first step. So they've opened up a new app. It's more than an app, but I spoke on the first Functional Forum about how healthcare is going to change when everyone has an iWatch. This is the first step to that. So this is their new platform, and in the new Apple software that's coming out, there is a ridiculous amount of health technology put into it. So very soon we'll be walking around with extremely complicated technology that will be able to read almost anything about us, and the interweaving of those factors will be a really big change in medicine. And of course, you'll hear about all of it first here at the Functional Forum. So let's talk about Lyme, because this is a serious issue. We're in New York. We're not far from Lyme, Connecticut. But this came out last year. So up until last year, the official estimates there were 30,000 people with Lyme disease in America. And suddenly they said, you know what, we were wrong by a factor of 10. So they thought now there's actually 300,000 people with Lyme disease in the country. A lot of people that I know that work with Lyme probably say they're wrong by 10 again, and there's more like 3 million. I don't know if I see a lot of heads bobbing here, but this is a pretty serious epidemic. And so, obviously we need to pay particularly close attention to this. Now, there's a lot of ideas as to where Lyme came from, and if you want to get really down into the details of Lyme and all that kind of thing, Dr. Leo Gallen's webinar next week will be a great talk about that. But I don't know if you guys saw this week, but Lyme disease bacteria has been around for 15 million years, says Jurassic Park scientist. And there was I thinking it was Plum Island 30 years ago. but apparently not, so who knows. But this was the Borrelia bacteria was found in a dead body that was apparently they can say that it was 15 million years old. Who knows? But this has been around for a while. So we've got to get to the core of dealing with this. Now, my wife has had Lyme. We used to live in Connecticut. She actually got it on Long Island, and we did antibiotics when it came out. I was working with I've had a lot of exposure to Lyme through energetics, and yet we went for the antibiotics at that time because I was basically unbelievably scared as to what might happen, and she was in a lot of pain. And we did that, and it was a great success. We did a bunch of other remedies that we'll talk about later. But with chronic Lyme, we have some other ways of working with it. And so what I wanted to do first was to introduce Dr. Mark Menolascino, because Dr. Mark, as well as being, there is no one out there who goes to more functional medicine conferences than Dr. Mark. He goes to almost every single one. I see him at a lot of them. He is now the Chief Medical Officer of Neuroscience and builds on a very strong pedigree in functional medicine, immunology, cardiology, endocrinology, and internal medicine, and also now adding immunology and others into it. So what I want to do for a starting point here is just to have Mark come and talk a little bit about the functional approaches to Lyme and what he's seeing going to all of these conferences. So if you would please welcome Dr. Mark Menolascino.
Put the lime in the coconut, you drink a bowl up. Put the lime in the coconut, you drink a bowl up. Put the lime in the coconut, you drink a bowl up. Put the lime in the coconut, it's such a silly
I'm not sure what to make of that. James told me at lunch that he was going to play that for you, so I think that's a great intro. Thank you for letting me be here. I'm honored to be in front of this group, and just a big shout out to James Maskell for really, there's very few people carrying the torch, and his is lit. So Lyme disease. What's a doctor from Jackson Hole up here trying to tell people from New York about Lyme disease? Well, for me, I'm one of those resort doctors like Mark Hyman. Not because I live in the most beautiful place on the planet, but because I'm the doctor of last resort. I'm the person that people go to when nothing else works. They've been to 16 doctors. I'm the 17th one, and they say, if you can't crack the code, I'm going to give up. So they come with their big charts. They come with their big pile of tests, and we try to think a little bit differently. And what I found, and since this is the Church of Functional Medicine, I'll tell you how I learned my church studies. I'm going to tell you something. I'm going to tell you what I'm going to tell you. Then I'm going to tell you. Then I'm going to tell you what I told you. And the big message tonight is it's not just infection. And so it's not just the antibiotics to treat the Lyme disease, the Borrelia. It's the hormone imbalance. It's the toxicity. It's the immune dysfunction. It's the GI dysfunction. It's the nutrient depletion. It's a mitochondrial dysfunction. You have to look at people in that spectrum disorder to really help get them better. If they have a bug that's releasing a neurotoxin, a year of antibiotics will not get them better. You've got to address the neurotoxin. You've got to address the intestinal permeability. You've got to address the heavy metal toxicity. And so we have a speaker on toxicity, a speaker on ozone. I think that's very exciting to hear that these other approaches are going to be discussed and looking at these other avenues, because it's not just one thing. A couple cases, I have three people I want to just tell you about. One was two brothers when I was training in Arizona. Why would you have Lyme disease in Arizona, right? It's not in Wyoming. It's not in Arizona, right? It's only in New York. No, it's in all 50 states. It's been seen everywhere, and it's spreading throughout the country and throughout the world. Two brothers went up to Canada, went canoeing for 3 weeks. They came back to the ER. One was more tired and had more pain than the other. Neither one really had a fever, but one brother saw the tick and had the bullseye rash. He was treated appropriately and got better. The other brother wasn't quite so clinically advanced. He didn't hurt as much. He wasn't as tired. He didn't have as much joint pain. And they did not treat him because he didn't see a tick and he didn't have the rash. 3 years later, I saw him in the neurology clinic being evaluated for MS. All of his tests were normal. His spinal tap was normal. His brain MRI was a little bit abnormal, as most of ours are, but it did not correlate to his clinical condition. While I was seeing him, I reminded him of his history of the tick bite, of the potential tick bite in Canada and his brother's treatment. He went to see an ILADS doctor and got better. I also saw another patient with MS that was wheelchair bound on triple drug therapy that was not working with multiple side effects. And she ended up getting tested for Lyme. And what ticked my interest was she was having day and night sweats. Why would someone with MS have night sweats? Maybe the medication. That's what the theory was. But don't parasites do that? So she was tested, and she had Lyme with multiple co-infections. She's now jogging on the beach. Now, that's not everybody with MS, but you've got to be thinking out of the box. And she had GI dysfunction from her antibiotics. She had nutrient depletion. She had toxicity from her drugs. And she had mitochondrial dysfunction from the poisoning of the drugs. Now, I'm an internal medicine specialist. And, it's interesting. If you talk to everybody in this room, everybody in functional medicine, we all have a story. I'm the fourth doctor in my family. I saw Neil Armstrong walk on the moon when I was 7. Of course, I want to be an astronaut. Why would I want to be a doctor? My dad was a doctor. My brothers and sisters were. Well, then this big Afro cardiologist named Dean Ornish shows up in Omaha, Nebraska. And he says, I'm going to take 100 men who've had heart attacks and are scheduled for bypass surgery, and I'm going to talk them out of it. I'm going to teach them how to eat right, teach them how to exercise, teach them how to meditate for stress, teach them how to love a little bit more, and I bet they do better. The doctors went crazy. They thought he was insane. He should be thrown in jail. The medical board should go after him. Well, guess what? I became his research technician. He's one of my mentors, a good friend of mine. 35 years later, less deaths, less recurrent heart attacks, less medications, more vitality, and he's angiogrammed some of them and shown reversal of the lesion. That's a game changer. If we could just teach people how to eat right, how to exercise a little bit, how to meditate, and how to love each other more, we wouldn't have this healthcare crisis. And that's really what functional medicine is all about. But along the way, you've got to do good medicine. The patient with MS with the night sweats, that could have been lymphoma. If you're not thinking and not doing good medicine, you could miss it. It could have been TB. I've seen 15 cases of TB in my life. And I gave those people 2 to 4 different antibiotics for 1 to 2 years. So why is a year of antibiotics for Lyme so unreasonable? It's not much different. And what is this Lyme? I was going to wow you guys with a bunch of slides and pictures, but I don't really want you to take home images. I want you to take home a feeling and a message. That it's looking at people through this functional medicine lens. Yes, identify the infection. Yes, treat the infection. But again, look at the hormone imbalance, nutrient depletion, intestinal permeability, GI dysfunction, mitochondrial dysfunction, autonomic nervous dysfunction, sleep disorders. It's the whole package, and you've got to look at people through that lens like that. I'm excited about what our company's doing with Pharmasan and that there's a new Lyme disease test. I'm kind of on a bandwagon. I've written several articles. They've been in the popular press. Why do we tolerate a Lyme disease test that's wrong half the time? Would we do that with AIDS? No, we only tolerate a 99% sensitivity test for HIV. We have one that's 30 to 50%, and we think that's okay. Now, the problem with a low sensitivity is what? Here comes statistics. Please close your eyes. If you have bad sensitivity, you miss people who are positively infected. And to me, that's the biggest crime. And if you give someone some antibiotics and they don't really need them and they don't get better, well, I think as holistic as I am and as integrative as I am, I don't like antibiotics, but I know they work. And when I saw my first Lyme patient, I co-manage a lot of people that in my area, they come to Cape Cod, they come to New York, they go to Wisconsin, go to Minnesota, and they come back to Jackson Hole. And they're being treated for these antibiotic protocols. And the first one I saw, I said, you're on 3 different antibiotics and an anti-malarial? I just don't really get that. But the thing about Lyme disease is that curly little spirochete, you need a drug that'll break its cell wall. You need a drug that'll go find it when it's intracellular because it loves to hide. And then that little curlicue spins into a little ball into a cyst form. You've got to have a cyst buster as well. And you also have to look at the co-infections to know what else to treat. Now, I'm not a Lyme treatment expert. I understand the protocols, and I like patients to be treated by an ILADS Lyme expert. Like James' wife, my brother-in-law got Lyme. He was treated appropriately immediately with doxycycline. He got better. It's the people that we test, or like the 2 brothers. Clinically, he didn't quite fit the picture. He didn't see the rash, didn't see the tick, and didn't get treated. Well, guess what? Less than half the people ever see a tick. And less than half the people ever see the rash. And we have a test that's 50% sensitive. No wonder there's a huge amount of Lyme out there that's in the chronic form. There's a new test out there called iSpot. The old test, the weakness is that it's a B cell test. And I'm not going to bore you with immunology, But that's the IgG and IgM. It just tells you if you've ever been infected. And it's only right half the time. The new iSpot is a T cell mediated that releases interferon gamma based on the antigens of the Lyme. It's 84% sensitive. You're going to see some new data being published that it may actually be almost 100% sensitive. This is going to be a game changer for diagnosing Lyme. We're never going to miss people who are positive now. It also lets you follow treatment. With the antibody test, you've got it or you don't. But it doesn't tell you, is your treatment working? With the iSpot, if you have high titers on your initial testing for positive, it drops as you're treated. So it's more sensitive. You can detect response to therapy. And I think those are going to be the two game changers with the new testing. So how are we going to spread this new lens? How are we going to teach people how to look through this new lens? It's going to be forums like this. It's going to be functional medicine. It's going to be the development of these protocols and the sharing of knowledge between all of us. I remember working in Arizona, and we'd walk around the hallways talking about leaky gut. You couldn't say it out loud. Oh, he's got leaky gut, I think. We should give him probiotics. You couldn't really talk out loud about this. And now there's Scientific American articles by Anthony Fasano. If you haven't seen that, go get it. It's about 2 years ago talking about the mechanism of leaky gut and intestinal permeability. There's articles in New England Journal of Medicine about it. So you're seeing the more mainstream medicine picking up on this concept. One thing I see a lot of times is I'll see someone with rheumatoid arthritis. Now, the Lyme infection can induce a positive ANA and a positive rheumatoid factor. But can't someone with rheumatoid arthritis get bit by a tick? Can't someone that has Parkinson's get bit by a tick? So we can't be narrow-minded and think everything is Lyme either. And with the new testing methodology, we're going to be able to tell. We're going to be able to separate the two of those out. And I think that's really going to be a game changer, being able to know where we want to look at this different pathway and how we want to follow people over time. The co-infections. This is the part that really scares me. Talking with Dr. Horowitz, Richard Horowitz in White Plains, who's one of the gurus in this field, he used to go out and catch ticks and grind them up and look what's in them. And they all had only Borrelia. Now they have multiple co-infections. Ehrlichia, Powassa, which is very scary, Anaplasma, Ehrlichia, Rocky Mountain spotted fever, Mycoplasma. The rule is now co-infection, not the exception. And again, we'll see this testing methodology I talked about being rolled out looking at these other co-infections. Well, why is that? Why are bacteria and viruses and these other co-infections increasing in frequency? What's going on in our world that there's more MRSA in the community? There's more crazy viruses that are being spread through the world. There's more co-infections in these other parasites. One theory that I think may hold some water is that it's a combination of our environment, both our human environment and our ecosystem environment. The chemicals we're pouring in, the toxicity that we're putting in the environment is driving a pressure for these bacteria, viruses, and other parasites and bugs to become more virulent and to develop different relationships to be able to survive more. And they're allowed to do that based on our own internal ecosystem and the environment that we're creating. The other opportunity for them, and I think is happening, is that we're crowding into their space. We're moving into other wild areas. We're reducing our areas that are truly wild and truly immune to human pressure. So the theory about that type of pressure is very interesting. You know, there's two different groups that talk about Lyme disease. It's the ISDA and the ILADS. And they're divergent but legitimate hypotheses about chronic Lyme disease. Neither one is wrong. And for acute Lyme, using the IDSA guidelines, I think that's absolutely appropriate. I like the ILADS protocols for looking at chronic Lyme. The numbers that James showed you, you know, there were 31,000 cases reported last year to the CDC of Lyme. It's estimated there's 10 times that. And again, I agree with him, it may be quite a bit more. Dr. Horowitz in a personal communication has shared with me that he was in China advising the Chinese government on their Lyme epidemic. 6%. That's 6% of 1.3 billion people. So again, this is not just a little bit of a problem. I think this really is an epidemic. How do I think of Lyme when people come to see me? Because I'm the resort doctor. I'm the guy with the big piles. when I see day and night sweats, I do good medicine, rule out the lymphoma, the TB, the other things that cause that. But that's a real key to me that there's something weird going on parasite-wise. When I see migratory pain, either in the muscles or in the joints, that's also a red flag to me. There's not many things that cause migratory pain like that. One of my nurses has kind of joked, she says, Mark, whenever you can't figure someone out, they always have Lyme. And now the reason I don't go to Lyme first is because the test hasn't been that valid for me. And I don't want to give someone a negative test and take it off the table and that never be just revisited again. Again, with the new testing, we have a proven 84%. I think you'll see the next paper coming out looking at nearly 100%. So I can tell that person for sure you do not or you do have Lyme. And if you do have Lyme and you go to see one of the gurus and you're being treated appropriately, the test will come down so you know you're physically getting better, but you also know that burden is going. Can you cure Lyme disease? What do you guys think? Can you cure it? I don't know. I think we can put it in remission. I don't know if we ever truly cure it. What is Lyme? It's a spirochete. Well, what is a spirochete? It's not a bacteria and it's not a virus. It's some weird thing in the middle. What other infection is a spirochete? Syphilis. How do we treat syphilis? Before we had antibiotics. How do we treat it? Heat. Do you remember that? We heated the body to 105, 106, 107 degrees so the body would maintain it and the spirochete would be killed. And I think that's why I'm excited about we have an ozone specialist here. I kind of think that maybe some oxidative therapies combined with some hyperthermia type therapies, maybe an adjunct with antibiotic therapy to actually rid the body. I know I've seen it go in remission. And again, whether it's totally cured or you ever really clear the body, because that Lyme spirochete can hide so well in the cystic form and the intracellular form, and it looks for places where you can't get at it. And then whether you believe in biofilms or not, and if you don't, you're probably missing the boat. There are several things that make biofilms, which is like a sticky gelatinous layer that it uses to hide from immune surveillance. These are very sophisticated mechanisms, very sneaky bugs. And again, when you start stacking them up together, it makes it a very difficult thing to treat. So again, I think, remember I was going to tell you what I'm going to tell you, and I'm going to tell you what I told you. The key here is you got to think about infections. And one thing we talk about in functional medicine is it's either foods, bugs, or toxins. At the end of the day, when you have a chronic condition, it's usually one of those three things. So I didn't believe in Candida. 2 women came to me and said, we know we have it, you go figure it out. I went to the world's experts, spent a week at their clinic, came back and said, well, I'm wrong about this too. Because in medical school, they teach us certain things. My first day, the chancellor came in and said, you guys are going to have a tough 4 years. At the end of the 4 years, half of what we taught you will be proven to be false. Your job is to figure out which half. Then they taught me in med school to motivate you by fear and guilt. Well, that doesn't work. And then they taught me that if I break you down in the Rene Descartes simplistic reductionist model, I can find the one pill for the ill. Or the Pasteur law of one disease, one cure. It's not that simple, and that's why I love this functional medicine about Lyme disease, because this is the prototype for all chronic disease. To give a shout out to Dr. Horowitz, he's got a new book out, Why Can't I Get Better? It talks about the MSIDS model, the multiple systemic infectious disease syndrome. And he's kind of got it's really a functional medicine 15-point model to look at beyond just infection. So you got to think about infection. Bacteria, viruses, parasites, candida. You've got to think about immune dysfunction. Are they HLA immune presenters that present bad things in bad ways to the body? Do they have other immune dysfunction like a positive ANA or rheumatoid factor? Do they have inflammation? And where's inflammation always start? The gut. Do they have hormone imbalance? I've heard several Lyme practitioners say that every man they see with Lyme has low testosterone. And so they're getting testosterone therapy, not lifting up the rock and figuring out the underlying cause. And that's the beauty of functional medicine, is you're not going to put another coat of paint on the rock. You're going to lift it up and smooth the dirt out and figure out what's really, really wrong. So again, look at these infections and the co-infections. Look at immune dysfunction. Look at inflammation, which by nature is GI dysfunction. Look at mitochondrial dysfunction. Look at nutrient deficiencies. Look at autonomic nervous system imbalance, heart rate variability, heart math, sleep disorders. All of this ties in, and not any one of them outweighs the other. You can have a sleep disorder, and if you don't get that fixed, I don't care what antibiotic you give them, they're not going to get unfatigued. I run nocturnal oximetries on all my patients just because it's such a common thing to be that sleep disordered. And sleep is one of the big things that we don't really understand it that well. So again, I think that's my message tonight, is that Lyme is a scary thing, and there's a lot of work to be done. There's two groups that support different opposing views. They're divergent, yet both legitimate. And I think the key is to look at that individual for yourself and try to come up with an individualized, personalized, holistic, functional medicine plan that ties everything together. If you can do that, there's no illness that walks into your office you cannot treat. Fibromyalgia does not exist in my practice. Chronic fatigue syndrome does not exist. Irritable bowel does not exist. Those people hurt and they're tired and they have GI dysfunction, but everybody has a unique reason why they have it. And the more that we can think about people like that, the more I think we can make a difference. Thank you very much.
Thanks, Mark. Appreciate it. So Mark was out in California this week with the Institute of Functional Medicine conference that was this weekend in California, and they talked about nutrition. It was from all the reports that I heard, it was an unbelievably good conference, and they described what they were doing there as nutrition being the ultimate upstream medicine. That's an interesting quote. But I don't think it is the ultimate upstream medicine. I think we can go a little bit further, and I think that toxic babies is a little bit further upstream, frankly. And this is something that I got really into when I had my first child last year. I started reading books, and the best book that I read was called Having Faith by Sandra Steingraber. It's an ecologist view on motherhood, and it's absolutely fantastic. But it's one of those books that you love to read because the information's so good, but you can't read more than a chapter at a time because it just makes you so angry about what's happening and all these, the things that are going on. So when we were putting this together, one of the things that I heard from Lyme doctors for years and years and years, all the way through I'm working, is that this toxicity was a big problem. And Mark touched on that. One of the reasons why the functional medicine model for treating this is valuable, because you're looking at the underlying function, and one of those things you're looking at is toxicity. And so a couple of weeks ago, I was doing a speaking engagement at ABC Home and Carpet, and one of the other speakers is a good friend of mine, Latham Thomas. And Latham is an advocate for empowering women to have a healthy birth and empowering the birth process. And she wrote a great book called Mama Glow, which is the basis of her brand. And I heard from her that day that she had partnered with the Environmental Working Group to bring out a new ebook on the sort of 9 tips on having a non-toxic baby. And I think that if we're looking to really get upstream of Lyme disease and upstream of all these details, we have to start there. And so I wanted to bring in Latham to talk a little bit about this and how the functional medicine community, what we're doing, can rally together to solve this big problem. So please welcome Latham Thomas.
I love what you do, but you know that you're toxic.
Have a little dance off later. So here's the guide. It's beautiful with the Environmental Working Group and Mama Glow, and we'll see if we have some sort of competition at the end to see who can take one home. So Latham, the first question I want to ask you, because we've talked about this. What do you think about the diversity in the functional and integrative medicine community?
Well, first of all, just thank you for having me. This is awesome. It's so great to see a group of people who are here on a night like this. It's amazing outside, so you could be anywhere else. So thanks for being here, and thanks for having me. But about the diversity, I think it's interesting. I remember years ago sort of feeling like we were all in a vacuum, and it was hard to find each other. And now with the advent of social media and all of the incredible platforms that people are using now to connect, we're finding each other, which is really interesting. I think that we're seeing that the playing field is changing. It used to seem to be like all men, and now there's a lot of women that are really coming to the forefront, and now people of color, I think, which is very important for people to see as well. So I'm excited for, I think, the new phase of what medicine and health looks like. And also, when we talk about diversity, I think that there's like a new shift where there's a little bit more of a dance between these sides where holistic thinking is being sort of delicately woven into the medical landscape in a way that I think is tolerable for people, but also that helps patients be more informed and empowered, and also creates a doctor-patient relationship that is less power over and power under, but more equalized.
Yeah, that's so true, and that's something that we've spoken about pretty consistently in the Functional Forum, is this change in doctor-patient relationship from patriarchy to mutual empowerment. I think that's a big part. So you've dedicated your whole life to empowering women in this birth process. What is it about toxicity and babies that gets you so riled up to spend, I don't know how many next few years of your life really on this?
Well, I was pregnant with my son, who's about to be 11 years old, and in that time, as a lot of people know, having a baby is the time that's really pivotal, where you really look at everything you're doing, from the foods you're eating to, like, if you're sleeping, oh my God, I'm worrying. Should I be worrying? Is that hurting the baby? Like, everything you consider. And that's why it's such an important capture for us, is because I want to help people, period. But this capture of an audience, you get to save 2 lives. So you get to help a mother change her lifestyle patterns and actually program her baby's cells for the future, for success. So if you are making tiny right actions every single day with your diet, avoiding certain toxins, which you talk about here, and also, your thoughts, and, engaging in powerful sort of community and feeling loved, like I think he was talking about earlier. These are all ways I think that we can sustain. And for me, I think, I just got so bothered by the fact that, the government doesn't regulate any of the chemicals that go into these non-foods, any of the products that are on the shelf. If you go to your cabinet, if you turn it over and you can't pronounce anything, if you have to research it, you probably shouldn't be putting it onto your body. Your skin's your largest organ. It eats everything. And all of that stuff goes into your bloodstream, but it also passes the placental barrier, which means that those toxins are in the umbilical cord and also pass through to the baby. And also we find that in breast milk, there's tons of toxins, So I was really upset that, our work was really focused around, nutrition and helping women, get fertile. And what I saw was, like, so many people, their diets were great. And I was like, oh my God, like, look what's in your cabinet, what's you're putting on your skin, what you're cleaning your home with, where you're living actually in the environment. And we had to really start working in that area. And it was great to have evidence-based research to back up, like, a lot of the claims. And with working with EWG, it was huge because, they're like the largest and most effective environmental advocacy and research group like this in the country.
Yeah.
So
how did that come about? How did they get in touch with you to do this project?
I actually met the executive director, Heather White, at an event, at a dinner, and we just started talking about kids and babies, and it was like a natural fit. We started working, our wheels started turning at that night, and we actually had a launch event on May 15th where we unveiled the guide, and we had a bunch of people from, different areas and show up, including some people from our constituency, as well as people in the environmental health and doctors, midwives, and people of that nature as well, and people in beauty and all the areas that we cover, really, to share what we're doing. We really want to spread the guide everywhere. We want it in all the doctor's offices and all the, any facilities that we can get it into, because we think it's so important. Ken Cook, who is the founder of the Environmental Working Group, was also at the event and shared his support for what we're doing as well at Mama Glow. So our job is really, as an organization, to bring the information and make it palatable and digestible for our constituency. And I think it's really important to make sure that people can get this, because it's information that's really hard to hear sometimes, I think, for people. They don't want to really talk about these things.
Yeah. Actually, that's a great point, because I remember in the very first functional forum, Dr. Brogan talking there about just the practicalities of being in this world, and once you know that there's all these toxicities and bugs and so forth, now trying to act when you know that this world exists. One of the things I think why I think this is particularly valuable is that, I think it sometimes takes someone who's a little bit more involved in popular culture to be able to communicate things in a way that happens. I see this happening in New York right now. Like, natural medicine missed New York and went to the West Coast, and it became big there, but people in Kansas don't care what people in California are doing. They care what's happening in New York. And it seems like right now in New York, yourself and various other people are sort of reaching a critical mass in the popular culture because you've been able to make this message digestible. Probably every doctor in this room knows about this and has known for a long time, but what do you think it's going to take to actually move the needle on this significantly?
That's a great question. I mean, I definitely think you hit it on the nose, though, with the messaging. I think packaging is everything, and how you articulate a message is very important to feel, to see whose ears it falls upon, and whether or not they actually take that and are inspired but mobilized to do something after the fact. What we do at Mama Glow is we're taking information that already exists, but also we created a methodology and a lexicon around a lifestyle. So it's not just telling people what to do, but also empowering people to live a life that's aligned with being their best selves and optimal wellness. So I think everybody could agree that they want to feel great. Yeah. Nobody wants to feel tired or moody or have mood swings, or everyone wants to feel really good. We have a record number of people we've been able to get pregnant because of our methodology, and people who we've sustained really amazing pregnancies and had great births with us. So for us, it's a lot of word of mouth, and I think there's a lot of social proof. And when people go to a great doctor, you don't have to tell anybody that you're a great doctor. Patients come because they've had a great experience. Yeah. And similarly in our work, we find the same. But I think that a great tool for anybody in the field is to create content, package it really well so that people can spread it for you. So we have this, it's going to be on our website by Monday, but we have some, copies that you can take. But to me, it's like a piece of, you can read this on the subway and pass it along to somebody else. And really what's really going to tip things is more education. I think people know this, but they have to actually entrain it on a cellular level. They really have to get this in their systems, and it has to be visceral. And I think when things become meaningful to you is when you're experiencing them. People talk about health and eat well, or they don't eat well at all, and then they get sick, and all of a sudden it becomes interesting, this information, right? Or similarly with pregnancy, it's I know tons of people who are living their lives, and then all of a sudden they're pregnant, and they're calling me. And I was I was doing this all along. They're I'm only interested now. So I think that, it just takes it has to, people have to see that this is happening around them. And that's why these things that you're doing are so great, because, it's not just who's in this room or who's online, but after here, there's a ripple effect, because there's people who are sharing information that they got here, or passing a flyer or whatever. So I think that, whatever you can do to language something in a way that's palatable for people, that's an entry point. And then you can, I think it's always good to lay it on with honey, make it palatable for people, because nobody wants to hear it in a way that's really hard. I mean, we talk about maternal mortality and infant mortality a lot in our work, but we can't just come through the door with that message, right? We have to find a way to package it that makes it palatable for people. Well,
that's an interesting thing with functional medicine, because you're speaking to the functional medicine doctor community online and here in person. What role do you think, this is a group of doctors that understand toxicity as a driver of chronic disease. Right. What role does this network of doctors have to play in solving this problem?
I think we all have to, or you all, I should say, have to commit and make it a big part of your work to spread the message. I think, especially where people may not want to hear that they're living a toxic lifestyle. It's the lifestyle that causes the disease. So the lifestyle is the disease. It's not. It's nothing else other than that. I think, like he was saying, talking about the bugs and the food, and then the whatever else, what was
toxins,
the
and
toxins,
the stress.
of course, and the stress. Like these are factors that that we actually put into play in our lives. They're all choices, right?
Yeah.
So like how you live, how you respond to something, what you put in your mouth. These are all choices. And so one of the things that it seems like, in functional medicine is huge for, looking at diet right away. And then people, when they go to other doctors, they're like, well, my other doctor didn't say there was anything wrong with what I was eating. And so then they start to say, well, over here, like these people must be weird because it couldn't be my food, right? Or it can't be stress. Like it's not, how bad is stress? So I think that, through these, in these moments that you have with your patients, like just going through it all. And I think when they start to see that there's that time, I mean, I know a lot of doctors don't have time, but like in that time that you do have, making a meaningful impact by trying to I guess blanket the information that you can, so that people can take it in, and giving the literature. But again, like packaging it really well so that it's digestible. I mean, there's tons of things we could have talked about. We picked 9, right? So 9 glow tips for your 9 months. And also we made it, as you'll see, that it's like, try these things. Like, here's the issue and try the things. So I'll just share what the 9 are. We first talk about some of toxic metals, neurotoxins like mercury and lead, fragrance, BPA, chemicals in food, harmful cleaning agents, toxic cosmetic ingredients, water contaminants, and flame retardants, fire retardants. And these are all huge things, that are like pervasive in our home, and in our environment.
Well, I just have to salute you on this, Latham, because this has got to the core of a couple of things that I've spent a lot of time doing. My first business was helping doctors to communicate their message more effectively, functional medicine, and I think that one of the things, it has to look like other things that look credible. There's all of this information out on the internet, but how are people getting it? So I really commend that. And then the first talk that we had back in February, for those of you who were there, where's Dr. Morris Beer? Attendance award over there. Dr. Beer's been at every functional forum. Do you remember on the first one I said, look, better to curate information for your patients than just tell them everything. You don't have a lot of time. Here's a very curatable piece of information for your patients. You can send it in an ebook, and they can get the information without you having to do all the talking. I really think this is going to be a game changer. I really appreciate you coming to the functional forum and sharing it, and keep up the great work.
Thank you.
Have a round of applause for Latham Thomas. Thank you. Thank you so much. Appreciate it. All right, so for the people at home, I know if you're listening on the live stream, you can ask questions for our Lyme disease panel that's coming up right now on Twitter with #FunctionalForum. I'm going to bring out the panel, and we'd love to have questions from you guys in the audience as well. So we have on the panel, and maybe Gabe, you can give me a hand with getting some of the seats out here. But we have, first of all, I'd just like to introduce Dr. Benjamin Asher, who's going to come and sit here. You can have a seat. Dr. Asher is an ear, nose, and throat doctor in New York who has ended up treating a lot of Lyme disease. He's been to a number of the functional forums and has really great results, and we're excited to have him here on the panel today. We can bring it over here, Gabe, into the middle. Then the next is Dr. Howard Robbins, and Dr. Robbins is an expert in ozone therapy and is going to be talking a little bit about that with regard to Lyme disease. A round of applause for Dr. Robbins. And then I'd also like to welcome Dr. Jody DeShaw. And Dr. Jody DeShaw was trained as a pediatric neurologist in India, now practices as a doctor of occupational therapy, and does bioenergetic and different types of strategies here, and has become well known in the serious Lyme world. And Dr. Mark Menolascino as well. So we've got a whole panel here to answer your questions. So I'll get my Twitter out, but I do have a couple of intro questions first. So Dr. DeShaw, maybe we can just start with you, seeing as you here on the end, and I can just ask you first. So, Doctor, you become a specialist in what is known as PANS or PANDAS, which is Lyme-induced autism, and that's obviously something that we're very aware of. How does Lyme disease induce autism?
PANDAS is a pediatric autoimmune neuropsychiatric disorder associated with strep. Strep is considered to be one of the co-infections of Lyme. PANDAS has now been changed, and it's being referred to as PANS to give it a slightly broader spectrum. I'd like to just start off with saying I am myself recovering from Lyme-induced Asperger's at my age. And if you find me struggling for words, word-finding difficulties, a few motor tics, it's just all part of the recovery process for me and my whole family with the Lyme co-infections, PANDAS, Asperger's. You asked me, your question was, how does Lyme induce autism?
Correct.
The kind of patients that I see in my clinic are patients that have acquired Lyme after having acquired autism or after being diagnosed with autism. And then predominantly the second kind of patient that I see in my practice is a child that acquired Lyme in utero through maternal fetal transfer, mostly unknown to the mother that she had Lyme disease. Dr. Mark mentioned Lyme surviving for years in the cyst form, which is mostly what I see happens, and there is quite a few number of research studies that have come out on maternal fetal transfer. As we know, Lyme disease has affinity for nerve tissue. It has affinity for connective tissue, for joints, and it has affinity for the gut. Now, when you have Lyme spirochetes that are able to generate proteolytic enzymes that can breach the blood-brain barrier, and that can also breach the zonulin-occludin tight junctions in the small intestine, that can attack the connective tissue. There are various symptoms that develop that look like what Dr. Jones calls as an autism-like syndrome. Let's go with one at a time. I've trained extensively. I've mentored extensively with Dr. Dietrich Klinghardt, trying to understand the biomedical and functional aspects of Lyme disease, especially in pediatrics. And I also work very closely with Dr. Ray Jones in New Haven. And we have several patients together that have Lyme-induced autism or Lyme complicated with autism and PANDAS. Neurologically speaking, some of the symptoms that are seen are neurological inflammation, increase in the neurotoxin quinolinic acid. We see autoimmune encephalopathy, which is development of anti-neuronal antibodies towards various targeted areas in the brain, like the brainstem, like the basal ganglia. You end up seeing symptoms like difficulty learning, short-term memory issues, rages, anger, word-finding difficulties, pragmatic language development. There are developmental delays that you see in the child. You see extreme sensory issues. You see obsessive-compulsive disorders. These are your central nervous system. In the peripheral nervous system, you see you have these children who are sometimes nonverbal, mind you. They're not able to express what's going on. They have feelings of creatures crawling under the skin. They have feelings of tingling, of numbness. They actually experience sympathetic overdrive, which would be panic attacks, which would be palpitations, which would be a drop in blood pressure when they stand up. And they're not able to express. The way they express is through behavioral. Most of the children I see are also complicated with with group A streptococcus autoimmunity, which is pandas, and then you see really high incidence of obsessive compulsive disorders. They have rituals. They have temper tantrums at all ages, pretty much. So overall, we see that this is looking very much like autism. Let's move on to Lyme disease affecting the gut. I don't need to go into details about leaky gut, but inhalation allergies, food allergies. Recent information is that gluten, everybody looks at gliadin, but there are actually 24 peptides or epitopes of gluten that can cause gluten sensitivity or reactivity. In addition to this, there are several cross-reactive foods that react, and the body perceives them as gluten, and you will get the same reaction as if the child had consumed gluten. So there is a lot of research that has come out recently, and there is more evidence towards looking at autism and trying to find if there is underlying chronic infections. Holistic practitioners in Europe report incidence of a rate of at least 85% of children with autism that they see have underlying co-infections. Practitioners in the U.S., from as far as I know, as a member of ILADS, the numbers they report is 20 to 25% of children diagnosed with autism may be co-infected with Lyme and its co-infections, and that's a pretty large number.
That's really interesting. So all of that, what's your strategy for treating this this complicated issue, if in a nutshell?
In a nutshell, I know. Well, I do tend to carry on. It's a topic close to my heart. I've seen my son recover for the last 4 or 5 years, but sorry.
That's okay.
In a nutshell, we try to address in my office the biomedical aspects, and Dr. Mark very eloquently mentioned various issues, like mitochondrial dysfunction. What's coming up now is nutrigenomics and methylation issues, polymorphisms. Those become very important. For example, if a child has, if a child has a CBS polymorphism, right, you have a terrible ammonia issue in the body, in the brain, that has to be dealt with. It becomes part of toxicity management and handling. Emotional issues, psychological traumas. We deal with underlying infections. I use homotoxicology, herbology. I've mentored with Stephen Buhner. He's an absolute trailblazer with using herbs for pediatrics, for adults, as far as Lyme and co-infections go. We also look at KPU. We look at mold and biotoxins. We would look at family dynamics. When I was training in Europe, I was amazed to see practitioners that treat children with autism will not accept a child often as a patient unless the entire family is willing to come together as a cohesive unit and be treated.
That's such a big point. I think that's a huge point, and I've seen that with your family and the way that it's a family effort, and I think that's a huge part of it. One last question I would ask, because I went to ILADS in 2011, and I saw Ann Corson, who I know you train with, and I asked her at the end, I said, Ann, I know you do all of these herbs and homotoxicology, why do you not talk about that? She says, well, I can't talk about that at ILADS, you should come and hear my ACAM presentation, I talk about it all then, right? So I thought that was interesting, but then I saw that now you are speaking at the ILADS conference, and you're doing doing homeopathy and herbs and doing, Klinghart's kinesiology. How are you able to overcome this barrier? Because I spent my first 7 years of my life working in this world, working in this world of homotoxicology and herbals. How have you been able to sort of open this up, and how are doctors reacting to these new methods that are a bit outside of their box and their toolkit?
All that really matters is results, isn't it? I've been blessed at being able to train with some of the world-renowned physicians that I mentioned, and I've trained in autonomic response testing with Dr. Klinghart, and it's been, you can call it a coincidence, but the patients that I see in my clinic that I have tested with muscle testing, but it's not just muscle testing, it's autonomic response testing, which I found is the most sensitive. It's based in quantum physics. It's based in Dr. Fritz Albert Pop's bioluminescence and biophoton theories. And the results have been accurate in the sense that when I've had the children come to me and we've done a full series of muscle testing, they've gone to Dr. Jones, who's run labs, and the results have been more or less identical. Then we've had children who've been on antibiotics for several years, have not gotten better. Dr. Mark spoke about biofilm. He spoke about mitochondrial dysfunction. He spoke about addressing toxins in the brain. Those are the aspects that I have addressed, and we have been able to take 18 to 20 months, shave that time right off the antibiotics that are needed for children, actually for the parents that choose to go down the antibiotic route. Yeah. That's just
so the results.
It's all
you've got to get the results, and that's it. Well, I really appreciate that, and thank you so much for sharing that. I'm sure we got some questions coming in on Twitter already, so I'll do that. Dr. Asher, if I can move on to you for a second, how does an ENT doctor end up treating Lyme? Why are you doing this, and how has it happened?
Well, when I moved to New York 10 years ago and opened up my practice here, I moved from Vermont, and the Lyme epidemic hadn't hit there, and I actually didn't know much about Lyme disease, but my practice is one where I basically treat chronic illness as it relates to ENT, and what I discovered is that a lot of the chronically sick otolaryngology patients actually have Lyme disease. So some of the conditions of fluctuating hearing loss and dizziness and tinnitus and sensitivity to loud noises were all conditions which appear to be, in many of those patients, they actually have Lyme. So I started testing. I was testing my patients, and I started treating them, and found that I was getting very good results. I actually had a patient once who came to see me. The thing that really blew me away is I had a patient that came to see me had a fixed sensory neural hearing loss for 7 years. He had been diagnosed with Meniere syndrome, and he was so dizzy that he actually couldn't find his way home from his office. And he'd had Lyme disease 7 or 8 years prior to seeing me, and I said, I think you probably still have Lyme disease, and I put him on antibiotics, and this fixed hearing loss that had been there came back. His hearing came back to serviceable, almost normal, and I was just, that's something that you just don't see in otolaryngology. And the problem is that in the ENT literature, the concept of Lyme and sensory neural hearing loss exists, but it said it doesn't matter whether you treat it because it doesn't work. And basically it's based on studies that you treat people with 10 days of doxycycline. Of course, nothing happens. So I became very interested in a lot of these conditions. I started treating and having very good results.
So outside of what Mark spoke about with the sort of general functional medicine model, what are some of the things that you're doing that seems to be really working for the treatment there? Because I know you've developed quite a well-known practice for doing this in New York now.
Well, I use a combination of treatments. So I use antibiotics, I use herbal therapies, and I use some German biological homeopathic remedies as well. I mean, I think that if anybody tells you they have the answer, they don't. So it's basically an ongoing work in progress, and it's a matter of trying new things. Every patient that I see is a different situation. Some people, you put them on a long course of antibiotics and they actually get cured, and that's the end of the story. Other patients are, so sensitive that if they even see the bottle of antibiotics, they fall apart.
Yeah.
So the question is what to do with those people. So it's trying to find the right protocol that's going to fit each patient. And having as many tools in your toolbox is the thing that's necessary to make a difference. And that's why some of the more milder homeopathic remedies are really helpful.
So I've got Dr. Lana Hirsch here on Twitter has asked a question. How can I learn about how to treat Lyme without taking out a second mortgage on my home? Would you answer that? Maybe I should save that one for Mark. Where did you sort of learn this, and what's been your iterative process of getting into it?
Well, I learned by experience and by talking to my colleagues who treated Lyme patients. So first of all is to not be afraid to take on patients and being challenged by people who have conditions that you're not entirely comfortable with, and realize that there's no cookbook. So you can't practice cookbook medicine no matter what, and you have to start thinking, well, maybe there's another way to do this. Who am I going to ask? Ask people, and then decide, treat as far as you can, and then when you can't treat any further, then send them on to the next person. Eventually, you treat more and more people, you start getting comfortable. The first Herxheimer reaction I had with antibiotics, I was like, oh my God, this is really scary. I thought my patient was going to die. I was so worried. But after a while, I started saying, oh, this is what happens when you treat people.
Yeah.
So you get more and more comfortable with it, and then the more comfort you get. I think part of it is also that I'm a surgeon by training, and I think that surgeons tend to be practically oriented people, and we are results oriented. And and I was comfortable in taking care of some of the sicker people too. So
that's great. Dr. Roberts, I know when you came to New York, you were an O2 guy. You were all about the oxygen bars, but now you're an O3 guy. You're more of an ozone guy. So tell us a little bit about that transition. And look, a lot of people are interested in ozone therapy. It's obviously interesting. I see it being used. I was looking at the other day, Hertz Rent-A-Car now. You can smoke in the car because they ozone the car at the end and they can get rid of the smoke. So I thought that was a cool thing that I saw, and I think ozone is growing in popularity for all sorts of cleaning. Why do we need to know about it for Lyme?
Okay. Well, first of all, thank you for having me, and thank you all for coming. We've been throwing out a word that I don't really feel moral or ethical to use, but I'm going to use it tonight, the word cure. I don't think a doctor should ever use that word or even promise or guarantee a result. Even if I've been successful 10,000 patients in a row, how do I know for sure I'm going to be successful on 10,001?
Yeah.
Having said that, and putting that aside, I've only seen stage 3 and stage 4 Lyme, whatever that is. I'm told it's the worst stages. I'm not an infectious disease expert. I'm an expert on how to get rid of infectious disease using ozone therapy.
Yeah.
And I've only gotten rid of it in every single patient. That's it. We haven't failed yet. This is my 24th year doing ozone therapy. We've done over 200,000 total therapies, about 10,000 treatments a year now. My patients are from all over the world. I train doctors from all over the world. I think this is important to say at this moment. A man who got me started in this, along with Dr. Robert Atkins back in 1990, was Gary Null, who many of you may know. Gary did a documentary called Ozone Therapy, The Miracle Medicine, just a couple years ago. I'm prominently on it, I will say, and you learn about ozone from A to Z. But he interviewed about 150 of my patients, chose about 40-some, and he chose 3 Lyme patients in a row that are on there, all telling you how they had stage 4 Lyme with all the neurologic problems and symptoms and how it worked. But here's why it works, okay? So we fill up a syringe, and it looks empty, but if it empty means air would be in it. Air is mostly nitrogen, and nitrogen would embolize and kill you instantly.
Yeah.
And New York State has a rule. You're not allowed to kill one person with functional, alternative, holistic, complementary medicine. But with my prescription pad, it's unlimited. Okay.
I think that's called the null rule, the null effect, right?
So, but it's basically the syringe is literally only filled with medical grade O2 oxygen and O3 ozone made from the oxygen. When ozone goes in the body, It indiscriminately kills every virus, every fungus, every yeast, every mold, every spirochete, every bacteria, every toxin, every harmful free radical. It even chelates toxic metals off nerve tissue, both peripheral and central nervous system, brain tissue, because it bypasses the blood-brain barrier. Because it does this and kills everything that doesn't belong there, I'm actually a hired serial killer, we win. Because, as you said before, I don't look on fibromyalgia as a disease. It's just a symptom of another condition. Everybody in this room has had an antibiotic even once in their lifetime. They all suffer from candidiasis. If you look up symptoms of candidiasis on the internet, every disease symptom is listed there. So what are you treating? The very first person on that video had multiple sclerosis, so we got rid of his MS. They couldn't get one person on herpes to come down until I called his wife up because I gave her husband back. She came and was willing to be interviewed how ozone got rid of her herpes. But with Lyme, we've had nothing but success in the worst cases because it kills all these different things. Now, from 1990 until about 3 years ago, I really didn't care about the rest of the world. I was very introverted in just helping and treat the families and people that I see in my office, and that was it. I am a Rotarian, and I decided that it wasn't moral and ethical to hold back what I do. So I went to the American Academy of Ozone Therapy's first meeting, and then I went to the International Association for Ozone and Healthcare and Dentistry's first meeting, and I let them know I exist. Next year, I was a keynote speaker. And the Robbins method and protocol, apparently I came on how to do it safely. Now, up until now, there have been three or four ways of doing intravenous ozone. You can do ultraviolet irradiation of blood. We did that early on. Helps a lot of conditions, gets rid of nothing, has a lot of risks, costly. We did 45,000 major autohemotherapies. That's where you take out a pint of blood, you ozonate it, and then you put it back in. That's the one used mostly around the world. So I have a unique experience doing 45,000 of them because apparently that's more than all the other doctors that do it in the U.S. put together to date.
I mean, that's an interesting point. You mentioned that earlier. Like, if it's that successful, why I didn't know. Like, when we first talked and you said that you were doing this, I was like, why isn't everyone doing this? This sounds like a no-brainer. What do you think? Why hasn't it caught on?
Well, that's a good question. And just to say, as part of that answer, it's been used for over 70 years in the modern ozone world, now by over 45,000 physicians in over 50 countries daily worldwide.
Okay.
As Frank Schallenberger, an MD friend of mine from out in Carson City, Nevada, always says on his emails, he goes, if ozone were a patentable medicine, you'd find it in every hospital. Since it's not patentable, there's no money in it for the pharmaceutical companies. Follow the money trail. Yeah. That's as simple as that. I'm going to be lecturing in Cuba in September at a big world congress. They invited me to come and lecture.
Do you think
I'll
they'll
be
let you
lecturing
back?
at their medical school. If I can get out of the country after
I've been to Cuba,
tell them.
but I got a British passport, so I just sort of did a little
Well, we're doing
switcheroo.
it legally with a visa and licensing from the State
good,
Department.
you're right
We're
then.
leaving from Miami
Okay,
on a
perfect.
chartered flight, so it's obviously very safe to do this. And my expectation is after my lecture, I'm going to be showing them how they can, I'm using this word again, cure so many illnesses from AIDS to hepatitis to Lyme, herpes, multiple sclerosis. I'm actually having really good, I don't want any autistic children. Emotionally, I can't handle it. God bless you. You're amazing to do this. But I've had some great results with autistic kids because I believe whether it's viral, bacterial, or toxic metal in the brain, ozone will chelate it out and destroy them. And that's why I've had some amazing results. It's long-term. It's not a fast fix.
Yeah.
And with Lyme, like you said, I tell patients you're going to need a long time for this, like these people on the video. 18 months, maybe 2 years even. But within weeks to several days, not several days, but even from weeks to a month or two, major differences in their symptoms. Major differences. By 8, 9 months, in most cases, doing it at a minimum of only 3 times a week. not my fast track protocol, which is 12 treatments a week, 2 a day, 6 days a week, you see major turnarounds. They feel like they're normal again. But I believe it because it hides away in every tissue, in the cerebral spinal fluid, in the lymph system. It's so pervasive. You've got to hit those when they come out of their Batmobile, the spirochetes come out of their shell and whatnot. You've got to be there to kill them, and it takes a very long time to really affect that. Now, if you add on what everybody else does in this room to what I'm doing, now you have an even faster result and more efficient result. I'm a Johnny One Note. I do ozone. I rather work as a team with everyone else who studies every supplement. I stopped doing that. I don't want to know, is zinc piconolate the right zinc to take? How often should you take it? What time of day? How much? How not? What source to take it from? You can do that. I don't want to do that. I just do ozone. And the results speak for themselves on the video and from my patients. All my staff that works at the front desk are patients of mine, or were patients of mine. 2 of them had stage 4 Lyme, and they're now functional, normal human beings again,
awesome.
Able to work for me.
Thank you. Thanks for sharing that, and I appreciate you doing that. We got loads of questions coming in from Twitter. So, Mark, can I ask you this one, Mark? What is the cost? This is from Jeff Glad, listening in Indiana. Hey, Jeff. Yes, and to answer your question, yes, you will be on the Mount Rushmore of the Functional Forum. What is the cost and insurance coverage for the iSpot test?
The iSpot is $389, and it's actually in review with the New York State Department of Health, so it actually is available to be used here in New York currently.
That's a big thing, because I know...
The website is www.iSpotLyme, little I, with the word spot, the word Lyme.com, and you can use that to get access to the company. And again, it is available in New York State. The Department of Health is reviewing it. We expect them to approve it.
That's big news, because New York doesn't get any of the tests. Dr. Asher, we've had a question here for you. This is from Terry Cole, who's in the house. Terry, where's Terry? She's not here, but there she was here. Terry asks if city dwellers need to be worried about Lyme disease.
Unfortunately, I think the answer to that question is yes. I had a patient who got Lyme disease in Riverside Park. And one of my colleagues was telling me that one of their patients actually found a tick. They hadn't left their concrete confines of their apartment and wherever they walked and actually the tick came in through their building. It was on their wall, and they were bit from there. So it is, it's not a high risk. Obviously, you're much better off in the city than you are walking around through the tall grass in the Hamptons, but you can get it in the city.
Yeah, sure.
So I ride my horse in Muttontown Preserve, and I can tell you without a doubt, Lyme ticks were about the size of the top of a number 2 pencil eraser.
Okay.
They're airborne. You don't have to be anywhere near a park. They can just be taken up into a good gust of air, travel several hundred miles, fall down, land on your head. You won't even see the bullseye lesion there, and they bite, they fall off, or you scratch and they're gone.
Yeah.
And now you've got Lyme disease and you live in the middle of an urban area. Never been to a park in your life.
That's so interesting. Yeah.
This kind of also gets back to that environmental pressure. In the Grand Tetons where I live in Jackson Hole, traditionally there's never been ticks on the mountain routes. Now the mountain routes, when we rock climb on them, they are loaded with ticks. 15 years ago, they weren't there at all, and now they're loaded with them. So there's changes coming.
Yeah. Jody, yeah.
Studies have shown that ticks are not the only vectors that transmit Lyme. Your common mosquito, bed bugs, head lice transmit Bartonella quintana. So there are other vectors that can transmit Lyme disease and co-infections as well.
That's interesting. Let's have some questions from the audience here. Yes, Dr. Jill Barron.
How do you prevent Lyme?
Yeah, prevention.
Do you have any lotions or creams? How do we live?
Jill Barron asks, how do we prevent Lyme disease? Mark?
The company Pharmacen that does the iSpot Lyme actually just produced a tick kit that will be sold nationally. If you do get a tick, it's a a little fork to get it off, put it in a container, ship it to the lab. They'll tell you what's in that tick if you got bit, which is another way to kind of end around whether you need to be treated or need to be worried about. The Lyme vaccine, which you've all heard about, I think is kind of a false way to go because of all the co-infections. And so I think that's not going to pan out to be.
Death.
I think it's all about the terrain in your body. If you adopt a lifestyle that maintains a healthy terrain that is unhealthy for excessive microbial growth, that is a big step towards living clean. I don't want to get into all that, but organic foods, what you cook in, what you put in your body, daily exercise, emotional health, forgiveness, spirituality. I think all of this plays a very big role.
I really appreciate you offering that, because that is really the functional model that Mark is talking about, and and I think that that's the medicine that all of us. It's very easy to get very scared about what's happening, but I don't think that's a good position to be as well. Look, we're very resilient, we're very adaptable, and the terrain is something that's ultimately under our control as well. Dr. Ash, you want to add something?
I would concur with that, and it is the question you ask when you see so many people with Lyme disease, and some people, the only complaint they have is their fingers are a little bit swollen, and that's it. And then other people are totally devastated. And I'm sure that some of that has to do with the virulence of the organisms, but a lot of that has to do with the host. And I think that those points are all very important.
And that's why I had to have Latham on here to speak about what Latham spoke about with the toxicity, because we have to start at, that's at age 0. A toxic environment is going to allow these microbes to breed and do things that they shouldn't be doing. That's the ultimate upstream medicine. That's why I think it's a great fit to have her in today. You'd like to add something?
Well, I was just going to say that cleansing I like to be a little bit happy about things at times, but cleansing, detoxification, Jill, using all the things that you do in your practice, strengthening the immune system. I'm sure people get bit by Lyme ticks and don't get Lyme. I'm sure it happens all the time. If we can't do anything with the environment. All we can do is fix our internal environment, make it so strong that nothing can live in us that we don't want to have live there, and then just be careful.
This makes me think of when I was asked to vaccinate my children for HPV. Why do some people clear HPV and others don't? It may be that terrain. And I think this new world of functional genetics may shed some light, which Dr. Jody was talking about, looking at your genetic SNPs to look at what your predisposition is to optimize the terrain. That may be the next forefront where this all moves to.
Can we have a large round of applause for all the panel? Thank you, guys. If you want to just head over, we've got 2 more minutes and then we're going to end, but there'll be plenty of opportunity. Thank you for being on the panel. I appreciate that. Okay, so I just wanted to end today. This has been a series of 5 functional forums, and we've had an epic lineup of doctors all the way through. And I just wanted to share here quickly what's coming up next and sort of where we're all going with this, because it's been a great starting point. But what we're really looking to do is to do something a lot bigger. And so I just wanted to talk about this. So, Mark, you're going to be in your head here. But on July 9th, we're going to be doing the Functional Forum live from Colorado. So you guys can watch it, and you can participate on Twitter just like other people have today. We'd love to have you watching on there. We will be doing some sort of Functional Forum type event in New York in July, but it's not going to be like this. It's going to be more opportunity for you guys to meet each other. I've told you about this before, but the Evolution of Medicine Summit is September 8th through 15th, and the live launch is going to be at ABC Home and Carpet. That's the next functional forum that's here in New York, and you guys all need to be in that. So what I wanted to do now is just say, look, what have we learned? If you take these 5 events that we've had, and I'm so glad that Dr. Robbins finished with what he said here at the end, because let's look, for those people who are not here at all of them, you can look at all of them back on the YouTube channel. But if we start with, look at Dr. Larry Pilevsky, who spoke here in March. Just what we were saying here is that there's more to the germ theory than there's letting on. It's not just about the bugs. There's an interaction with the bugs and us that, and we have some control over some part of that, and it's a lot more complicated, it's a lot more nuanced than we think. Add into that, like Dr. Kelly Brogan here, how many of these Lyme patients are being misdiagnosed? Tell it's all in your head, and suddenly they're in a psychiatrist's office and they don't know why. We can't be misdiagnosing inflammation as diseases of the psychiatric disorders. And then if you want to look at someone like Gabe Hoffman's talk from the first Functional Forum, Gabe and I started the Functional Forum, he talked about empowerment being the new compliance. This new type of medicine that we're practicing, it can't be done with the old patriarchal model of the doctor fixing the patient. The patient has to be absolutely involved in the whole process. And we've had amazing other speakers leading up to last month, which was a seriously epic event. And, looking at someone like Dr. Jeff Glad, who's proposing an opportunity for small functional practices to be popping up all over the country to treat these kind of diseases and make the value proposition at functional medicine so much stronger than your local hospital that people go there first for their primary care. And then, Mark Hyman, look at the difference that we're making. Look at these forces outside of all of your practices that are taking this message and everything forward. It's a very, very exciting time to be part of this. Gabe and I both really appreciate, all of you guys coming here. The first time we did this, there was so much slush outside. You couldn't even get in through the front door. Now it's a beautiful summer evening. We really appreciate it. Gabe, I know there's probably something you'd like to share on this, the last 5.
Yeah, absolutely. I just feel tonight was just a real culmination of the first 5 events. Our vision in creating this event and when we started it was to really, what we talk about, create a platform where doctors and new information is being shared that's also honoring, some of what Latham Thomas talked about, what individually we can do ourselves in terms of what we put in our bodies, managing our internal environment while having cutting-edge clinical approaches. And then on top of that, creating another type of environment where people are meeting each other in this room, and just to have had some of that start to show up with Dr. Glad and connecting with Dr. Hyman. And, I just see tonight the vision really just showing up much more clearly, and I'm just really excited about it and really appreciate everyone was here. And, just some of the things that went on in the panel, just hearing about ideas that maybe some doctors hadn't heard of and them sharing it. I think the future of medicine and the future of life is really going to depend on this type of event, this type of communication, and these types of people meeting each other. And we're excited to continue to bring that to you as we move forward and making it bigger and better and, more intelligent people, which obviously this room has been filled with since the beginning. So we just really appreciate it.
This has been the Functional Forum. Thank you very much. Good night.